care in the Bay Area. And she took a crack at Barcelona for a few years and made that happen. But I think we're most familiar with her work at Marin Community Clinics, and as chairperson of the board, then as the CEO, major changes happened, all consistent with the quality, culturally relevant care, and Linda was the architect. And so rather than going through all her major achievements, and there are many, they are significant, and we could be here till the sun sets, I decided to take a look at what are the essential ingredients that fuel this dynamo. What is it that keeps her pushing against all boundaries? The first, I think, is love, and her love of first family and then close friends. And I want to acknowledge Frank, you're Linda's husband, and Jim, their son, here. But then it goes out, it radiates out, and there's a viral contagion of people that want to be friends of Linda. In fact, I was thinking that I'd get a t-shirt with Linda's friend, because we are all Linda's friend. And there are anthropologists that are studying this phenomena. And the view is of this British anthropologist, Robin Dunbar, is one who has looked at the structure of the brain and primatology, and he claims that it's 150 people that we can maintain stable relationships with. That's sort of like Linda before noon. It's like she's such an outlier to this process. A friend of mine, a colleague, and I did a back of the envelope calculation, and we figured that it's somewhere between 1.25 of Marin County is a friend of Linda. They know who she is, they've talked with her, and if you've ever gone to eat or had coffee with Linda at a restaurant anywhere in the Bay Area, it's an endless stream of people that are coming up and want to have some time with Linda. They want to be remembered. And Linda remembers their names, the kids. She knows what schools they were attending, where they work, and how things are going. It is amazing. So I think that's all based on her love of people and her commitment to that special something. So the second issue that I think is all part of this equation. I'm just reflecting for a moment. Pat Kendall, I haven't seen Pat for quite a while, and she said she gave me some good advice. Keep it simple, keep it meaningful, and keep it short. Okay, so I'm in the process of violating just about all of those. The second issue is Linda believes that the world can be a better place, and that it's her responsibility to make it a better place. That's not optional, and she helps us all see what our responsibility is and how we can do that. And I think that's where the love and the making the world a better place all come together. And the third is that she makes the impossible possible. She's like Clark Kent. She'll bound over tall buildings to make it happen. No doesn't exist once she's on mission. And the beauty of it is that her style is that it becomes everyone on the team's mission. It's not, again, this contagion factor, it's so positive, it's so energizing, it's so uniting that then the possible becomes possible. And Linda, I have this for you that is a little something that is a token of that, and you're free to open that. There's a lot of suspense here. I know that you're going to be required to model this, and you may have to go up to the stage. I figured that is, if we had a branding team here, that's the brand they would make. So Linda, it's really delightful to be here with you this evening to give you this Lifetime Achievement Award as a small token of being such a spectacular, dynamic person.
Breaking rule number one, I hate stages and I hate podiums, and so I saw Mitesh do this, stand down here. I said, oh boy, I can do that too, and I won't have to go up on the stage. So Larry, thank you so much. I know that my husband and son were just bathing in your words, because what you said is what they say every day. And in Frank's case, for 50 years. Jimmy's only got 48 years into it, you know. But the reality check is a reality check. So this is a Lifetime Achievement Award. I'd like to spend a few minutes telling you what I think about our movie called Lifetime Achievement. So we'll start with the producers. The producers have to be all of our parents and families who made the people that are sitting in this space tonight who you are. Always giving, always caring, always helping, always bringing on new items, new things, new care at the clinic, new care at the hospital, tolls with an S, and new care for everything and everybody that you perceive needs that care. They don't have to be underserved. They don't have to be in special need. They're just all of us. I mean, best as I can tell, unless I'm doing something wrong, we all have needs. None of us are free and clear of being in need of each other and what we have to offer. So my first thanks would go to our producers, which are all of our parents and families. So after producers, when you're running a movie, you have directors. So special thanks to everyone in this audience who has been a director, be it an elected director, an appointed director, director of a department, director of a clinic, director of a hospital, and directors, public officials, cities, counties, and foundations, and all the people and all the other agencies that I've had the pleasure of working with. So we then get to the stars in our movie of Lifetime Achievement. The stars in our movie are, in many cases, each other. They're the doctors, the nurses, the caretakers, the therapists, the agency heads, the people who work in front of the scenes and behind the scenes, the medical assistants who care for the patients. And in my particular case, there's a whole long list we could go through, but in my particular case, I want to thank publicly the three people that have taken care of me for 30 years. And they are Laura Carlos. Where are you, Laura? Laura Carlos, Isabella Mahai, Isabella, and Alice Rushdie. Alice, haven't you? Okay. So Laura got the long-term deal, 25 years, you know. But any of you that know me, I have never been late for a meeting that I know of. I've never been out of sync with whoever was supposed to be at that meeting, because Laura generally thought of who it was, and so did Isabella and Alice. And, you know, I've eaten really well, because they would figure out what I like to eat, and they'd send me to those restaurants. So I'm particularly fortunate, and they have truly, I have not been working a lot lately, and man alive, it's a good thing, because I've got a calendar that is such a mess, you have just never seen anything else. But I've been very lucky and very blessed. We are, yeah, I am also grateful, Larry mentioned this, my leading men are my dear husband Frank of 50 years, and my dear son Jim, who trust me when I tell you, they put up with a lot. They really have. And you know, Larry, I loved your words, because it's actually how I see myself. That, you know, I just love everybody. And people say, how could you stand so-and-so? Well, I can stand them just fine, because I think they're wonderful. And, you know, if they don't suit you, that's your problem. But, you know, they suit me. And I'm just very fortunate. The other thing is, you know, so I'm still friends with my friends in the Bronx that I grew up with. And then I get to this point in the conversation, and I would say to all of you, I haven't got a single idea, really, how I got here. I really don't. And I say this to people, and they just say, yeah, right, uh-huh. Well, let me tell you a little bit about it. I get 5 minutes. I think I've killed 3. So, okay. I went to 5 grammar schools in 3 states in 7 years. Oh, wow. I skipped 2nd grade, not because I was so smart. They said I was a bully. Can you imagine? I'm not kidding you. My mother was here. She would attest to this. And so I kind of missed a few things. You know, many of you in this audience have trusted me with big budgets. I don't know how to do decimals. I don't know how to do percentages. And I don't know a lot of things, to which my CFO, most recent, will testify. And so will all the other CFOs. But the reality check is that, you know, I think that because I care so deeply, I've been in healthcare for 55 years. And I can name the 5 bad days I've had in 55 years. I could tell you about it, don't have time. But it's, you know, it's just been a total blessing. So then, you know, we moved from Alabama to New York, and now I gotta go to high school. Well, grammar school was enough of a problem, but high school was a significant inconvenience. It interfered with, you know, what I thought was my goal in life, which was to be the girl singer. We were girls then, before we were women. Girls, the girl singer in the group known as the Platters. And that was my goal in life. There were 2 problems. Zora Taylor had the job, and they seemed quite happy with her because she could sing. And I couldn't have gotten the job anyway because I can't sing, but that was the goal. So I went on from there, and, you know, I've been blessed completely through it all. Somehow got over my, you know, sort of high school's an inconvenience, and decided I better learn something, or else, at the time I had a part-time job in Woolworths, any of you who remember Woolworths, and I think my father said, you want to do this for the rest of your life? No, I really want to sing with the Platters, but, you know, what are you going to do here? So I went to school, and, you know, I learned a lot of things at school. At college, first of all, I got snapped out of the Bronx, where I had lived the West Side Story. I mean, West Side Story is my life story. That's what we did in the Bronx, you know. played in the schoolyard, went to dances on Friday night, and we didn't shoot each other, but you know, it wasn't a peaceful environment because there were a lot of gangs in the Bronx in the 50s. But so I, you know, went to school. I learned how to play bridge. I learned a lot of things. School was, you know, very interesting. But I got snatched out of there and sent up to a small college next door to West Point, the military academy, next door. Now, when you come from the streets of the Bronx, living West Side Story, and you end up at West Point, you got a problem. You know, it's just not gonna really work out. But it worked out. So I am so eternally grateful for everything I've had and enjoyed and been and done and not been. I have a lot of, you know, things I don't do well. Ask my husband and son. But I'll tell you what, it has been a blast. Now, I have flunked retirement 3 times. I know that somewhere I'm going to do something, but I don't know what yet. And I'm, you know, kind of doing some work for Mitesh. I love Mitesh. Picked him myself, and he's a doll, and doing great. And I'm very proud. And I'm proud of Mark Shotwell, who took over from me at Ritter Center. And I'm just very lucky and very, very blessed. And I admire it and love it and say, oh, goody, how did you get here? I don't know, but you're here. However, I want you to know that each and every one of you in different ways has contributed to my life. And each and every one of you in different ways has earned this lifetime achievement with me. It is my honor to receive this award on your behalf to recognize every single thing that you've done for this community in healthcare, in every other way that is touched here tonight. We're about to have a chat about dentistry. The dental services at Marin Community Clinic are sort of a 10-year-old form of life that started with 6 dental chairs and is now 27, I believe. Is that the right count, Connie? Wow. 27 chairs. It's been an evolution, but Connie and I were just talking earlier. You could put 100 chairs into this county and fill them up. And so I thank each and every one of you. This is your Lifetime Achievement Award because we all did it together to make happen what's happened in the last, I've been here 37 years, and boy, could I write a book, and I may. Thank you all.
Linda.